Well, good afternoon. I'm David Stockwell. I'm the Medical Center Director for VA Northern California Healthcare System. And let me just start by thanking each of you that have taken time out of your busy schedule to join us this afternoon for a veteran town hall meeting. We're doing this virtual style. Obviously, we're in the middle of a pandemic still, but we're hoping to actually reach more veterans. So I'm not sure how many of you are actually logging in live or may watch it on tape delay, but we're glad that you've joined us this afternoon. I have with me several of my colleagues. I have our Chief of Staff, that's the lead physician at VA Northern California, Dr. William Cahill, here to my right. And then to my left is Kathy Bucher. She's our Chief Nurse Executive, and she's wearing her face covering. I have mine on. I have mine here as well, and I took it off just so that I could actually, you could read my lips while I'm talking during this meeting. Again, we're glad you're here. Just a few rules of engagement as far as the town hall meeting. We're hoping to have a lot of dialogue during a town hall. Town hall works best when the town participates in the meeting. And so we're looking forward to your questions as you submit them on Facebook Live, and we're going to do our best to answer those and to dialogue with you about what concerns you. Please be careful not to be sharing any personal information during the discussion, so generalize topics, and then we can talk about that would be best rather than handling specific issues on a particular case. But again, we're glad to be here with you this afternoon. I thought I would just start and open with a few comments, kind of talking points about how things are going during the COVID-19 pandemic here at VA Northern California, talk about our moving forward reopening plan, but I certainly want to leave enough time for questions and answers that you may have. And so you can start typing those in whenever you've got them, and if I've already addressed your topic, then I won't go back and repeat that, but if it's something that I didn't cover, or you need additional information on, happy to dialogue with you in that regard as well. So let me start with our moving forward plan. So we were given permission on June 8th to begin reinstituting some routine care here at VA Northern California. So as most of you know, from mid-March until mid-June, we were only doing urgent emergent care for in-person visits. We continued to do virtual care, telephone care, video conference care with our patients across our system, but no elective surgeries, no routine care for that 3-month period. And on June 8, we were given permission to start going back forward and inviting some veterans back in for routine care. We're about 25% capacity at this point in time, so we are doing now some elective surgery cases. We're doing some GI and procedure work. We're starting to see about 25% of our patients in face-to-face clinic appointments. That doesn't mean we've stopped doing virtual care, so we still have a number of video care options, telephone care options for patients. And then, of course, only at 25%, you may have been waiting for your routine appointment. It may have gotten canceled sometime during the spring, and you're wondering, when is the VA actually going to schedule my future appointment, or how long might it take? And so at 25%, we're still not back to 100% capacity. There's still plenty of demand for people ready to come in for their routine care. And we're doing the best we can to try and ramp up and provide that care, but to do so in a safe way for our patients, for our staff, and to protect the scarce supplies and limited resources that are available during this pandemic. Many of you may have heard national discussions about personal protective equipment. Those are the masks, the gowns, the gloves that are required to keep healthcare workers safe, to keep patients safe from their healthcare workers, and we need to make sure that we have enough of those to go around to, one, adequately don our staff with safe protective equipment, and to make sure we can provide care in a safe fashion for our veterans with that same equipment. And so monitoring those supplies is a key feature on how far we can reopen all of our services here at VA Northern California. So I just wanted to make sure that folks were aware of that knew that we were starting. We started on June 8th, reopening for some routine face-to-face care. Of course, during this whole time, we've always had urgent and emergent care. If you need healthcare, our ER has not closed for 1 second during this entire pandemic, and it is available. Our 24/7 telephone advice nurse has been available during this time, and walk-in care for urgent needs is still something in both mental health and primary care that we've been continuing to address throughout the COVID-19 pandemic. And so if you need resources, we're here for you to provide health care, but we are starting to reopen some of our routine care. As far as overall, how hard have we been hit by COVID-19 at VA Northern California? We've had a total of 39 of our 100,000 veteran patients that have confirmed positive COVID-19 since the inception. Now, of those, many have recovered. We have 5 patients that are currently active COVID-19 patients out of 100,000. So if you think about that in kind of context, the general Sacramento area, it's about 100 to 110 per 100,000 people that have contracted and have confirmed COVID-19 diagnosis. And we're at 39 out of 100,000 in VA Northern California. So we've actually had a lower infection rate in the veteran population as far as confirmed cases from our patients than the general population of the county. As far as our staff goes, we've had a total of 9 of our staff that have been positive COVID-19. 2 of those are currently active, so the other 7 have recovered. None of our staff have passed away as a result of COVID-19 at this moment in time. So in context of how is our staff done? So for example, the state of California is at about almost getting close to about 0.5% of the total population has a confirmed COVID-19 diagnosis. Our staff is less than half of that. And so even though we're healthcare workers on the front lines delivering care in the midst of a pandemic, our staff have actually contracted COVID-19 at less than half the rate of the state in which we reside. And so I don't say that because we are overly proud of the fact that we have a lower infection rate, but we're trying to keep you safe, we're trying to keep our staff safe, and so far the math has said we've done a pretty good job at both of those while we've continued to provide care during COVID-19. As far as testing goes, so we've done thousands of tests for COVID-19. If you get the test because we're worried you have it, you're called a person under investigation, a PUI, and we treat as far as what materials we wear, what protective equipment, differently than a patient that isn't suspected to have COVID-19. And we've tested thousands of veterans since we've started monitoring. If you're a veteran and you want to know whether you currently have COVID-19, you can now come to the VA at any of our 12 locations at VA Northern California Healthcare System, and we will provide an on-demand test for you. Now, under that scenario, you're actually not a PUI or a person under investigation because we don't think you have it. You didn't fail one of our screening locations and then have to get the swab, but you're just curious, do I have it or do I not, even though you may not be portraying any symptoms. You can come to the VA and we'll provide the test for you. You don't get immediate results. It takes a couple of days for the results to come back under that scenario, but they are available to you as veterans, and I wanted to make sure that you were aware of that today. Masking. I mentioned my face covering mask that I brought with me but wasn't wearing during the video. And as a reminder, every location of VA Northern California, a face covering is required for everybody on our campus in any public setting the entire time that they're here. And so if you come to a VA Northern California site, you're going to be given a mask if you don't have one, but we'd like you to bring a face covering with you and actually expect to wear that throughout your journey here at VA Northern California. All of our staff are wearing the masks as well. Now, this is not personal protective equipment. So the face covering that you have keep you from aerosolized droplet. It's not to safeguard you. The idea is we don't know which of us has COVID-19. We don't know which of you may have COVID-19. And everyone wearing a mask prevents droplets from being as prevalent in the air that we're breathing as we're walking through the organization. And so it's an attempt to mitigate the spread of COVID-19. And frankly, wearing the mask keeps everyone else safe. And so we all wear masks. It keeps us all a little bit safer. And so just wanted to make sure that expectation was there, that you were aware of that moving forward. We are still screening individuals at all of our locations as well. And so if you come to any of the 12 sites in VA Northern California healthcare system, you can expect that you'll go through a screening. It's a series of questions that you answer, and depending on how you answer the questions, there's a secondary level of screening where your temperature will be taken and we'll do a little further investigation. And there's a tertiary level of screening where if you become a person under investigation, or we're worried you might have COVID-19, where we're going to do one of those nasal swabs. We're going to test you for COVID-19, and we're going to ask, actually, under this scenario, unless you urgently need care, that we're going to provide it remotely, virtual care, rather than bring you as an active COVID-19 patient into one of our facilities. So most of these screening locations are outside of the healthcare system in a little tent out front and a little station that's outside. In some cases, because of the warm weather, we've moved those directly inside, but on the edge of one of our buildings where that screening will take place. So if you come to VA Northern California, expect to wear the mask, expect to go through the screening station, and oh, by the way, we're still not permitting visitors to come to VA Northern California. So if you have a caregiver that needs to accompany you to your appointment, we can create a process for that to happen. But if you're just coming to hang out at the VA, if you're bringing an entourage with you to your appointment, we're not going to allow visitors to come into our medical center. And again, this isn't to be cruel. It's actually to prevent the volume of people gathered in one place and to help mitigate the spread of COVID-19. So those are kind of just a few overview points of how things are going and what you'd expect if you come to VA Northern California. I wanted to walk through what's different if you do show up other than the screening and the masks. And so here's 5 new expectations that you could have as a veteran if you come to VA Northern California. The first is more virtual care. Now, we've been forced to do a whole lot of video appointments and telephone appointments and virtual appointments of this, that, and the other during the pandemic. And what we've learned is that oftentimes this is a great way to provide quality care. It's more convenient to the patient who doesn't even have to leave their home. It's safer for our staff and the volume of people that are coming and going. It helps our parking challenges to a grand extent here at some of our locations. And it's a great way to continue to provide care. In fact, we've been providing, I think, 90% of all of our mental health care has been in virtual capacity, and much of that is going to continue. So one thing, expect more virtual care to continue in the future as we make it more convenient to access your healthcare team as a veteran in VA Northern California. Number 2, social distancing. So there's fewer chairs in the waiting room. They're spread apart further than they were before. There will be markers on the floor as far as staying separate. So if you're in line at the pharmacy, you're not going to all be in as tight of line as maybe historically you were used to, because we're putting social distancing factors into our healthcare systems, into our clinics, into our waiting rooms, into places where folks may stand in line. And so you may see protective barriers, guards, distancing signage that looks different than it did before as we're incorporating social distancing into who we are as a healthcare system while we're still in the middle of this pandemic. The third thing that might be different that you can expect is more texting. So frankly, if you're waiting for your prescription and you're in your car and we can text you and say, hey, it's now available and you can come in rather than waiting in the line at all. So you can stay removed from us, we can stay separate from a big crowd, and we can communicate via text. So whether that's a lab, a pharmacy, your appointment that you've checked in for and they want to tell you you can come right in to the exam room and avoid waiting room in entirety. And so we're still learning how this texting part works. We're still trying to roll it out. in a broader context, but expect more virtual communication even during your visit to VA Northern California as we try and navigate the let's not congregate together in one place. It's part of the social distancing, but it's a new technology. And so if you're not familiar with texting, fair enough. That won't be a mandatory communication, but we're going to try and use texting a whole lot more than we have in the past as a way to communicate and to keep people talking, but not face-to-face per se. The fourth thing that you're going to notice, and I hinted this at the beginning, so we spent 3 months without doing any routine care, any elective procedures, any surgical cases that weren't urgent or emergent, and not buying any care in the community for that matter, while the community shut down for a number of months. And so this is a big backlog of patients that are waiting for routine care. You're not the only veteran that may have had your appointment canceled during the spring. And as we come back and start providing care, you can expect that our clinics are pretty busy, that our staff are pretty busy as they're continuing to provide care with additional cleaning and room turnover, donning and doffing of personal protective equipment in different ways, trying to use texting as a communication as people are navigating. It's a little slower. There's a little less face-to-face appointments, but the volume of people who need an appointment has continued to go up and in fact has increased during this time. So you can expect we're going to be pretty busy as a healthcare system. And so as you attempt to make your follow-on appointment, that new appointment you've been waiting for, and it's further out than you had aspired for it to be, it's just a reality. So I'm not thrilled that we have longer waiting times, but I want it to make clear to veterans that's an expectation, that our system is so overwhelmed. We're not used to taking 3 months off. I'm sure there's a joke in there somewhere for government employees or something like that, but we've been working hard, and now we're going to be overwhelmed with the volume of care that's going to come into our healthcare system. So expect some busier clinics and potentially some longer waiting times as that plays out in reality over the summer, probably into the fall, and who knows how much longer that this challenge is going to be with us. And then the fifth thing that I think you'll notice is different, and I hope this part actually is true, and that is a better understanding from our staff to you, our veteran patients. You know, you all have put your lives on the line. You've been on the front lines. You've been at risk to protect others during your veteran experience. And for the last 3 months, the workers, the employees of VA Northern California, healthcare workers, have been on the front line, putting themselves at risk, being out there in front trying to help others. And so the understanding that what you all have gone through to grant freedom to us as citizens of this country, I think that the healthcare workers, having lived through a smaller version of that over the last 3 months of being at risk, at work, on the front lines, they're going to have some appreciation for what you have done, and there's going to be some better connection. So I hope we've actually improved our understanding of veterans as kind of living through this, maybe it's germ warfare over the last few months, but a better understanding because we've actually walked through it as healthcare providers for a couple of months at least as well. So those are 5 things that are different. I've now spoken for about, too long as an intro in the town hall meeting. So I'll be quiet there. I just want to give an overview of how things are going. So let's see what questions, and Will, I'm hoping you're going to help navigate those for me.
Absolutely. So one of the questions, the first question was actually about testing, and I know you touched on that a good bit, but they wanted to know if the VA intended to offer the PCR, nose swab, or serology testing, as well as any rapid test kits. And I know you already touched on that, sir, but maybe reiterate because we have a lot of folks.
Yeah, so I'm actually going to ask my Chief of Staff, Dr. Cahill, who's here to my right and has been well-versed in all options testing. In fact, he's even tried several of them, I think, himself. So, Dr. Cahill, what do you have?
At least one of them. So, we do have the PCR rapid tests, and we are using those for very specific patients, the ones we're most concerned about, the ones we're trying to, we haven't decided to admit to the hospital, or somebody that we're going to be moving. We've checked out in our emergency department, but we're going to be sending back to a group living setting, such as a community nursing facility or something like that, where we have to be sure that we can return the patient, the veteran, to that facility without causing a risk to the other patients that are there. So we do have that. We also have, as the director already mentioned, the on-demand testing. We will be using a process that we will be sending out to one of the contract labs in the community. I know that process it can take, it can take anywhere from a day to up to 5 days. Every one of them has broken my heart in the last 3 months at some point. Usually when we flooded them with a large number at one point in time. In between, we also have, we're developing a process that we should be able to do testing on patients who are going to have a major procedure, a major operative procedure. They're going to be starting radiation therapy. They're going to be starting chemotherapy for leukemia, say. We're going to be testing those patients, and the reason we need to test those patients is because those procedures can affect the body to the point that if they were harboring the beginning of an infection, they hadn't become quite symptomatic yet, if they were harboring it at that point in time and we did that procedure to them or started that treatment, they would have a worse outcome based on reports out of the countries. So we're going to be doing that sort of testing. That result will typically be within 48 hours of the planned procedure or 48 hours of starting the chemotherapy. So we're using a different avenue for that. So our laboratory is very busy trying to sort out where the specimens are going to go to try and keep them all timely. It doesn't really help us a whole lot to ask the question, do I have an infection now? And I don't get the answer back for a week. That's a little bit late in the course of the way this infection goes. We separately were working on IgG studies. So there's antibody studies as opposed to the PCR. Do I have the infection now? The antibodies say, did I have the infection, and I mounted a response to that infection. Not everybody seems to be mounting a response from the preliminary studies. For instance, off the studies of the Navy people who were on the aircraft carrier, not all of the ones that tested positive ever developed antibodies. So we'll be doing that. We're in the process of validating that with our equipment to make sure that everything's working properly. And then we also have to set up a process of how we might best use that. Clearly from the observations that have been made so far in various countries, you can't count on it. I have the antibodies, so now I have this immunity passport, so I can do whatever I want. I can go to the pool parties, I can go to the grocery store, I can go to the ballpark. That doesn't seem to be the case. So we have to define how we're going to be using it. We may use it to help us analyze people that have tested positive to see really what is going on and help confirm the process. So we're working on testing in a variety of ways.
The next question is in reference to community care. They're asking when the community care referrals will be unpaused.
So let me ask our chief nurse executive, who also oversees our community care program, to respond to that. Kathy?
Gives me a chance to take the mask off. Happy to announce that we have begun scheduling our community care backlog. We were running into several thousand appointments that had to be paused. I do want to reassure all of you that those consults were evaluated very carefully to assure that any of them that fell into an urgent or emergent category for those consults that really needed care right now. Those consults were dispositioned early on in the COVID experience, and many of them were returned back into the VA for care, or we continued to press forward to get them scheduled into the community. One of our challenges today is that, like the VA, the rest of the nation and California is just now reopening, and they're reopening at various different paces. And so some of our contracted vendors and outside providers that we've used through our Tri-West contract have begun to open their doors slowly. That is also putting a slower pace on being able to get many of our consults scheduled. However, we have recently been able to bring the University of California, Davis back into our contracted list, and we have added Sutter Healthcare System as part of our community of options. And so we've expanded, while we've been waiting, we've also expanded our opportunities. So we believe that we're watching our metrics carefully every day to be sure that we are making steady progress towards working down the backlog and getting your appointment rescheduled. We will continue to look for opportunities, however, for you to receive care in our new modalities of virtual care back in the VA, because that doesn't require necessarily a location for care as much as an opportunity of a provider who is experienced and ready to go to give you that care. So we may have those conversations with you in the future.
The next question is, someone mentions that they live in June Lake and they're registered in the Carson VA, and they go to Mammoth for the remote care. I think they're asking, what are the rules as far as them getting care across the various sites? If they're registered at one VA, can they get care at a different VA?
Yeah, it's a great question. So a couple of things. VAs are reopening at different speeds at different locations. And so what I declared for VA Northern California at the start of this about our June 8th and sort of 25% volume of routine care that we relaunched, that isn't necessarily true for a different VA. Every network or region of VAs has a pilot site that launches, and then they pay attention to what the infection rate is in the community, how much PPE they have on hand, their testing capability, their staffing capabilities, and they make a determination as far as their ability to go forward. And so I can't speak for another VA. However, once you're in the VA system, you can get care at a different VA medical center from the one that you're officially registered at. And so our computer system has the ability to transfer some basic information from one location to another so that our provider might be able to see what your last visit notes look like, or what prescriptions you're on, or that type of thing. And so you can come in and get care at a different medical center than the one that's your home VA, if you like.
There's a follow-up question regarding community care. How do we know that the physician has passed a COVID test, and do they carry some sort of certification that they are safe to provide care?
That is a really interesting question. At this time, we have not had an agreement with our Tri-West third-party administrator that the community care partners who provide care for us have some kind of clearance by doing their own COVID-free testing. We don't test our own providers unless they are showing symptoms or they are in high-risk patient care settings. For example, we have tested all of our staff in our community living center. We test all of we are about to start testing our staff in our HEMOC oncology infusion clinics, because they are treating the most vulnerable of our patient populations. But it is an excellent question about what will happen in the future with our relationships and service agreements with Tri-West and its contracted providers, about what we would require in regards to at the very least, their screening process before patients actually come and receive care in their offices. I'll take that as a do-out, and we'll post an answer so we can see where Tri-West is going with this. Thank you.
There was a comment, sir, about how we unnecessarily closed our clinics in response to COVID-19. I'll let you detail how we didn't actually close the clinics, but what actually occurred in response to COVID-19.
Yeah, so I know there's a lot of debate. Did you do too much? Did you not do enough? And there's a lot of different opinions. But let me just say, we never closed any of our clinics any days during the entire COVID-19 process. So anybody that needed urgent emergent care could come in any of the days. Now, some of our clinics aren't open on the weekends, but the days that they were open could come in for urgent emergent care. We also continued to provide outpatient care as we clinically triaged each of those visits and made a determination about whether it was time-sensitive care or not. So our chief nurse executive just mentioned our cancer clinic, hem-onc clinic. We continued to see patients and provide treatment. Dialysis patients continued to get their hemodialysis during COVID-19. So we didn't close down. What we did was ramp down the volume of routine care. Was it necessary? Was it too much? You know, some of it we were following national guidelines, some of it we were following state and county guidelines as far as expectations for who could travel, for what circumstances could you be out and about. I think we're trying to be thoughtful. So we don't know a lot about this pandemic. Maybe it's not as bad as people thought it was going to be. Maybe not as many people have gotten severely sick as a result, but we're learning as we go. And safety is the top priority at VA Northern California Healthcare. We don't want to harm patients. We don't want to harm our staff. We want to be here. So we very thoughtfully said, let's keep open the services that are essential for veterans to make sure that we're helping them for their urgent needs right now. Let's take a pause, let's see how this plays out, and then let's safely try and move back towards providing that routine care. So we're back in that mode right now. Hopefully we'll be able to continue in that mode. I do appreciate that the sort of the Monday morning quarterback review might say, maybe you didn't need to shut down as much as you did. Others would say, what do you mean you're reopening already? Aren't I still at some grave risk? And so there's a variance of opinion. We're trying to do what's right, following national safety guidelines, keeping our staff safe, and providing care to veterans. And so very thoughtfully, we've done what we did to not only ratchet down the services, but now ratchet back up the services moving forward. So I do appreciate that input. It's a great question. Thanks.
The next question is just asking how the expansion of in-person patient care is going to play out in the dental care.
Yeah, so dental is actually a really interesting, there's a lot of aerosolized procedures that are done when your mouth is open and they're looking at stuff inside of there. So I'm actually going to let my chief physician, Dr. Cahill, answer what you can envision moving forward with dental care.
So yeah, dental is probably our highest risk to our staff actually, from being exposed to aerosol generated in an area where the virus is easily cultured from, and so we have to figure out how best to protect them. At the present time, we use the face shields, the N95 masks to protect them. But every procedure, we typically have two people in the room, the dental assistant plus the dentist, who are working with the patient. And so we're using a lot of our protective equipment for each individual patient that we provide care to. That has, if we, on a normal day, treat approximately 200 veterans around our system with procedures where we generate aerosols, that would far and away be larger than any other group that we have to protect and we have to provide services to. So they would be a big user of our protective equipment. Now we have plans in place. We're trying to purchase these Pappers, which are a device that a staff could use all day long, protects the staff while they're working with our veterans to care for their needs. And once we get those, it will allow us to do more procedures. In the meantime, we will probably be holding back on the number of cases, the number of visits that we can provide to veterans for dental care to just, again, the urgent and emergent. And what was not considered urgent and emergent 2 months ago might be clearly urgent and emergent now. So we're still seeing veterans every day for those kinds of procedures. While we're trying to ramp up to roughly 25% level, as the director stated, some of our clinics were actually a little bit ahead of that. Some will be behind. Dental will likely lag a little bit behind just because of the high rate of usage of the equipment that we would have to protect our staff.
Papper Pressurized Air Purifier Respirator. It's an acronym. The government loves acronyms. So if you're wondering, that's sort of like the astronaut suit that you wear that purifies the air. So if you were wondering what a Papper was, I thought I'd help out with that part.
Not as bad as the mop gear that we all trained on for chemical warfare. It's better than that.
All right. Will, do you have other questions for us?
Absolutely. So there's a similar question about what kind of eye services, eye clinic services will be available moving forward.
So eye is also one of those areas where we do historically a lot of our care through contracts within the community, a significant portion. Now we are ramping back up eye care. Eye is one of the clinics that's above the 25%. We have been doing urgent care, emergent kind of procedures, seeing patients for glaucoma or other things that they will get in trouble with very quickly and put a risk to their vision. So we've been doing that all along. We are expanding to more routine care in eye, but one of the issues that we're facing, while we would like to send care out in the community isn't fully reopened to be able to handle that care yet. So as you know, we're trying to build up, so is the community. So this will allow us to work down this backlog. We're very concerned about the backlog. We're very concerned about the waits. It's been an impact across the country, whether you're inside the VA or not, whether you're getting care as a veteran through the community or not. We've all been impacted, and we're trying to work out of this so that we can catch up on that backlog.
Mm-hmm.
Next question is, someone was asking about mental health access throughout the COVID-19 response and what that looks like and what capabilities we have to provide that kind of care.
I want to say a few comments, and I'll certainly have Dr. Cahill mention as well. I said in my opening remarks that about 90% of our mental health care during COVID-19 has actually been virtual care, video visits, and telephone visits, and that we expect that to continue in the future. So we've been, when we had three choices what we did with routine care when COVID happened, we either said that care can wait and happen in the future, it's urgent or emergent, we're going to continue to have that care face-to-face anyway, or we're going to convert that care to virtual. And the vast majority of our mental health care, we were in fact able to convert to virtual care modality and to continue to provide that care. So COVID-19, sheltering in place, isolation, these are not the friends of folks that are pursuing oftentimes mental health assistance through the VA. And so being there, being open, being available, we're going to continue to provide that mental health care. I want to stress at this moment that if you have an urgent mental health care need, we're here for you at VA Northern California. We want you to call us, to come in person for an unscheduled visit, walk-in care. We'll evaluate you, and if you need care right away, we're going to provide that in a mental health setting. So we're here, we're not closed, we are ramping up. I think we're only going to target about 10% of our mental health care face-to-face appointments at this moment in time and continue to do about 90% virtually. But Dr. Cahill, did you have anything you wanted to add about mental health?
So I would like to emphasize that was one of the things that has been a major learning experience for us, how we can use virtual care and behavioral health. So our staff got a lot more comfortable. Our staff in mental health have been doing virtual visits for some time now, but clearly tremendously increased that in the last 3 to 4 months. Our patients have also gotten more comfortable with virtual care, and again, that's not just in mental health, it's in primary care and in the specialty care areas as well. We're all learning how to do this better. There are a group of veterans that would much prefer to have their visit taken from home. There are other veterans that feel, no, I really need it face-to-face. We're trying to accommodate all that. As far as the same day care, yes. If you have an urgent issue, we want you to reach out to us. We will, we want to be able to interact with you. It may be that we're going to offer it to you as a virtual, or if you come in, we will see you face to face. We also have, keep in mind, with our PCMHI program, where we have mental health providers embedded in the areas where primary care is seeing patients, so we can have a warm handoff between the two services if that is needed. Now, granted, primary care has also been predominantly virtual, so there has been fewer of the face-to-face handoffs, but that can also be done by virtual visits. So yes, we will, going forward, that is going to be one of the changes that you can expect, that more of the care for mental health will be done virtual, basically from the comfort of your home. We're trying to figure out how we can do group visits that would be as effective and impactful as we have in the past, while paying attention to social distancing. So we may be figuring out a role for virtual care in that as well.
We have a question from a veteran who asks, if they were to develop some COVID-19 symptoms, would they be covered by the VA if they were to go to their local ER, or should they come to the Sacramento VA Medical Center?
It's a great question. Anytime you have an emergency, the VA has a coverage plan for veterans that qualify for a layman's view perspective in an emergency to go to a community ER, and we'll pay the community ER, we'll authorize that care and pay for it on behalf of the veteran. It does have to be for what's viewed as an emergency, and so severe COVID symptoms would certainly qualify under that regard for the VA to cover and to pay for that care. We actually don't want you, if you're that sick, we actually want you to get care timely and close to where you're at. So if you live a long way away from Mather, don't be a hero and drive in your car for 100 miles to get access to that essential timely care. I don't want somebody with a heart attack driving their car a long distance just to get to the VA. We have the ability to pay for that care in the community. You declare yourself as a veteran, you're enrolled and actively enrolled in the VA, and it meets that layman's view of an emergency, and the VA will cover the ER visit. So thanks for asking that question. That's an important one, and I hope that works out well for everybody listening.
And then there's a question about how the VA NorCal is faring compared to other healthcare facilities as far as the rates and numbers of folks who are actually having COVID-19 cases and other issues related to COVID-19.
Yeah, so I touched on this at the start if you hadn't joined yet, but our infection rate from the veteran population is about half of what the community infection rate is in the Sacramento area. Infection rates in Alameda and Contra Costa County are actually higher than that, and so our infection rate favors comparably. So fewer veterans in our care have actually gotten COVID-19 than the general population that lives in the communities with which we exist. As far as our employees go, it's about half the infection rate of the state of California, and as healthcare workers sort of in the line of fire, that's actually a significantly lower rate than many other healthcare facilities and their workers. So I think we've done a good job keeping people safe, but this is a long battle, and so sometimes we talk about COVID-19 as something that has already happened, and now we're just leaning forward. The reality is, there's actually been an uptick in California in the last few days in the volume of newly confirmed COVID-19 cases. We need to continue to learn, to be careful, to be safe, and to move forward with our eyes wide open as far as this pandemic goes. And so we're going to continue to try and do what we can, from personal protective equipment, from hand washing, from social distancing, from wearing these lovely face covering masks that are becoming a new style feature for your wardrobe, to do what we can to try and prevent the spread of the virus. So I think we've done pretty well to this point in time. It's a great question. Thanks for asking.
There was a question as a follow-up to the dental care question on who exactly qualifies for dental care through the VA.
Dental eligibility is a unique one in the VA. Unlike most of our healthcare, there's kind of a uniform benefit package that all veterans that enroll in the VA are eligible for. Dental's sort of high-end option. So you have to be 100% service-connected disabled veteran. You have to be service-connected for something to do with your dental care. You have to need dental care in conjunction with something else that's service-connected, or you're on your first, it's either 90 or 180 days. Oh boy, I'm going to get it wrong. Hopefully Mr. Graham can correct me if he's typing in. I think it's the first 180 days post your discharge DD-214 that you can come in and get one-time dental care through the VA. So it's pretty limited eligibility. If you meet that criteria, that's how you're eligible for dental care in the VA. Otherwise, there are a few veteran-friendly dental options that veterans can pay into to try and get care in the community for their dental care as well. So hopefully someone will correct me, because I can't remember if it's 90 or 180 days post active duty discharge that you're eligible for that care. But otherwise, that's the eligibility for dental care.
Yeah, and Ryan Scheel, our site manager in Chico, has said it's 180 days.
Oh, I should have not questioned. I guessed right the first time. All right. Thank you, Ryan.
There's a question just how our wait times are comparing with other facilities as well. What is the status of wait times for VA healthcare system?
It's a great question. You know, that was one of the major themes for the VA pre-COVID. You know, what do wait times look like? Are we meeting that 20-day for primary care and mental health, 28-day for specialty care? And frankly, we haven't been paying much attention to wait times since COVID-19 happened. Everything shut down. The community shut down, as Kathy Bucher mentioned, and our ability to schedule patients in the community. Our own care we couldn't schedule. And so what the VA said was, we're going to stop paying attention in the short term to wait times. So I can't tell you today how long our wait times are. It's also difficult to calculate with a 90-day pause. So if you on February 28th were referred to see a specialist for a routine consult, now you've been waiting all the way till mid-June and it hasn't even been scheduled yet. That's a lot of days of wait time. And so they're going to be a challenge for us. I mentioned that in my opening remarks. I think it's going to take longer to get a VA appointment than it did before the pandemic, because our system is frankly overwhelmed. The community is also overwhelmed because they also shut down for an extended period of time. And so even buying care is tougher than it used to be. And so we will get back into starting to measure our wait times and to see how quick we are and what options we have available to veterans. But in the short term, we have not paid attention to wait times. So I can't give you, here's the stats on what wait times look like, because there's this funky reality of this long pause that we had and different rules that happened during that pause that aren't allowing us to give you an exact number to say it's X number of days to wait for your appointment. Anything you want to add to that, Dr. Kale?
Just adding on to that, our secretary has emphasized that when we reopen, when we are moving forward to re-expand our clinical activities, safety is the primary concern. So while we know we've been building a backlog and we've been doing our best to make sure we're tracking, we don't lose anybody that's been sitting out there waiting for their appointment, we're not allowed to just say, okay, we're going to open up, and we will have to go slowly. We've been targeting 25% because that is what we are being allowed to do while we're being monitored very closely, and we're monitoring ourselves very closely to make sure that we have all the resources to handle this, that we don't burn through all our protective equipment, for instance, and have to shut back down again. And as we ramp up, we realize we're going to have to get back up beyond what used to be our 100% capacity level if we're going to work down this backlog. We hope to get there, but we are basically being throttled down and will remain somewhat restricted as we move forward for some time now, and it's a bit unknown. It's something that's very concerning to us. We certainly feel the issue that, hey, I've been waiting already, my hip is bothering me, or this is bothering me, or that is bothering me, I really have a concern. We really feel for that, but we're also being limited about how fast we can catch up.
Yeah, I wanted to also jump in here. We've taken advantage of this time to build a new program called the Referral Coordination Initiative, which I think is going to make a big impact for those of you who are on the receiving end of consults for specialty care, or who would be expecting to be sent perhaps out to the community. The referral coordination team will be actually working with you personally to identify what your preferences are based on current understandings of wait times, not only here in the VA, but also what was the likely wait time for you in the area of which you'll be receiving care, and your preferences will be gathered to determine whether or not what direction you'd really like to go. And that could actually include going to one of our other sister VAs as an alternative altogether. So it's something new that'll be added to the mix as a way to increase our efficiency of being able to ensure that you get the care you need where you want it to be, and take into the mix the information about wait times as well. More to come.
Well, it's been I understand we've had some technical difficulties during this hour that we spent together on Facebook Live, and I appreciate your patience in enduring with us. We're trying to figure out how it works too, and frankly, I have a new respect for TV news anchors and whatnot. There's a 20-second delay on our video from what we're watching from what you're seeing, and it's not helpful to my psyche. I can't collate between the two. And so you may not have gotten your specific question answered. I know that we've had 100 people or so actively watching, sending questions in. If we didn't do that, our social media team will do their best to answer those questions moving forward. But I do appreciate you taking the time to join with us to kind of hear what's going on in VA Northern California. Let me just, before we conclude the Facebook Live event, to say thank you for your service to our country, for the sacrifices that you've made in your life in defending our freedoms. This has been an interesting time, not just from the pandemic, but a lot of the social unrest in our country right now. These are challenging times on many, many fronts, and there's a lot of people that are in fear, in anger, in confusion, and this is a time where we need to rally together. And so we want to be here as a VA healthcare system to be a part of that solution with you as you journey through that these times together. I want to recognize veterans. You fought for our freedom. We're in the midst of trying to struggle with our freedoms to move about, to be free, to be fair, and it's a difficult time. And it's a reminder that you fought hard for where we're at. There's much work to be done in our country moving forward, but the foundation that was laid through your sacrifice is noteworthy. We want to be here to serve you. Thank you for all that you've done. We're going to do our best. We're not going to be perfect, but we're going to try and partner with you, listen to you, just like we did today, listening to the questions that you had, so we can improve the services that we deliver to you. And we're going to try and be thoughtful, scientific, safe, helpful in meeting those needs as we continue to go through this pandemic. So thanks again for joining us this afternoon. I think we'll go ahead and conclude at this point in time. Again, if you found it helpful, you can refer other veterans and they can watch it on our Facebook page, not the live version where they can ask a new question, but to get this information firsthand if they'd like. So again, thank you, and we look forward to doing this again, maybe even person to person in the not too distant future. So thanks.